And back to what you were saying about your mom, the awareness for lymphatic drainage wasn't really out there. For the longest time, there weren't very many lymph therapists. We were lymphatic therapists for lymphedema, which is a swelling that happens due to damage or dysfunction of the lymphatic system. And now public awareness is starting to come around. Kind of unfortunately, lymphatics has become a buzzword, and all of a sudden, a lot of very improper and inadequate trainings are coming around. Being a lymph therapist is not a one weekend workshop, and it is certainly not something that can be learned online. So I ask the public, please do your due diligence when you're searching for a lymph therapist. You want to look for someone who has been through a program approved by the Lymphology Association of North America. This will at least ensure that there were standards in their training, that they got the science, they learned how to do proper lymphatic drainage. Of course, this doesn't guarantee that that's going to be a good therapist,
Yeah.
but at least that therapist did get proper schooling. We see a lot of very strange things on Instagram and on YouTube. I had a 8-part series with the wonderful Robin Devine. She is an instructor for the Chickley Institute, and we talked about that we're seeing a lot of weird, deep, and aggressive work that's wholly inappropriate for post-surgical. And we're also seeing therapists who are using oils and lotions, and they're sliding and gliding all over people. That is not lymphatic drainage. It is necessary that we're actually sticking to the skin and providing a very specific stretch and torque to the skin. And that is how it actually makes the lymphatic system work.
Well, and to that point, if you've been through chemotherapy, or if it's on your horizon, or if you're a caregiver for someone, I had no idea how much you hurt. Your joints and your muscles just ache. So, not knowing about you yet, someone gifted me a massage, and I hadn't been, through my second and third trimester of pregnancy. I was sore. I was like, I really need this. And I tried to lay on the massage table and pad my port, because I still have the port in. And it was so excruciating for my body to receive that massage. And I kept asking her, which I never do, to touch me lighter. I said, a little softer, a little softer. But I was sore for days. And what I actually did was I hurt my healing. I set myself back because all the pressure in my muscles didn't actually squeeze anything out that I needed it to squeeze out. It caused further inflammation, bruising even. So, what I would suggest, me personally, is if you do want a massage, try this first, because you want pain to leave, and that's not a pain. Um, that's not a pain exit for your body, like a hard massage. Like, what do they call it? Like shiatsu, and they're great when you are not going through chemo, and you can get one every now and then. But what Ellen does, it's very light to the touch. Well, after a second session, the two fibroadenomas were shaped like lima beans, and they were around the tumor. So you could see the tumor on the MRI, and you saw the lima bean fibroadenomas. And we knew that they were just dead tissue. But from just the lightest touch, my breasts were sore for probably 5 to 7 days after that first and second session. The second one's when we did, I think, breasts. And those fibroadenomas broke up and they left. And that created an opening for the tumor to now start being worked on and grabbed on by like the lymph system. And so it's a good sore because everything's moving out.
And that was a very gentle
Yeah.
and specific touch. So don't
Nothing's hurt here.
underestimate don't
Nothing's hurt.
underestimate the power of when you get proper lymphatic drainage
Yeah.
done. It's going to feel very light, very relaxing, but then it can have incredibly profound results. Definitely. And if you are someone who's going through cancer treatment, or your post-cancer treatment, you really do need to see someone who is trained in oncology massage and or a lymphatic therapist, which I happen to be both. So you should not have been face down with pressure on your port. You are not rated for deeper work,
Mm.
not now. Maybe at a later date we
Yep.
can work with that, but not now.
It's just things that
And
everybody needs to be aware of.
that's something that we're working really hard to educate the public, get that word out there, that not all massage therapists, their training is different, it varies, and you need to see someone who is appropriately trained to treat your specific conditions.
I would get out of influencer world if I were you. You can do lymphatic exercises. I know there's things that loosen up your system, like simple stretches, but if you need an actual true drainage thing, don't see your local influencer. And you need to thank God that he provided me a team so close to home. If you are in Carroll County, West Georgia, you couldn't ask for a better team. Like I said, from Ellen to Gwen and Clyde to Dr. Anderson. And I've got a lot of other cool things that are going on because I'm growing my hair. I mean, I didn't lose my hair. Thank you, Jesus. Look at this beautiful hair. But I have certain hair salons that can work with patients that need non-tox things. I have non-tox skincare going on right now and detoxing, pulling chemo out of the pores because that's a process as well, growing your eyelashes back without getting ingrowns, certain oils that you can have on your face. So everything about my life right now is a walking healing. Like everything we do every day, every meal we eat, every exercise we do, every appointment we have. And we're just really glad that you're here.
And I'm glad you're here. And thank you to Holly.
Yes,
Thank you,
Holly.
Holly. Well, awesome. Thank you so much for sharing your story.
Yeah,
So now, everybody, now you know who Megan is, and hopefully we'll be putting out some more videos as we continue her journey. Again, I'm Ellen with Advanced Massage Therapies in Carrollton, and this is Megan Rogers. If you're watching this on YouTube, please subscribe to my channel. It really helps it grow. It doesn't cost anything, and I would certainly appreciate it. I'm also going to leave in the links down below, links for Megan's social media, and if you'd like to follow her journey on Facebook and
yeah.
Instagram, you can do that too.
Definitely reach out if you have any questions. I talk to a lot of women about a lot of things, so I'm an open book.
Awesome. Thanks.
Thanks.
Have a great day.